ventricle and institution series of 42 patients. Intraventricular mass lesions have unique surgical challenges since they have deep location and they are related to important and critical structures. Choosing the appropriate approach for each patient depends on many factors such as the location of the tumors, size of the tumor, diagnosis, vascularity, venous drainage, and the relationship to the surrounding structures. The transcallosal approach offers a direct access to the ventricular system bilaterally. Risk of seizure is much lower compared to the transcortical approach. One recent study showed that the transcallosal approach was associated with a significant increase in risk of seizure. Our method, we did a retrospective chart review study, a review of 42 patients who underwent surgery for tumors of the lateral and third ventricle from 2004 to 2015. Demographic, clinical, radiological, surgical, histopathology, and follow-up data were reviewed and analyzed. Our result, a total of 42 patients, 20 males and 22 females. The mean age was 25 years, range 1 to 65 years. The location of the tumor were located in the third ventricle in 23 patients, lateral ventricles in 18 patients, and involving both lateral and third ventricle in 1 patient. This is one of our cases, craniopharyngioma before and after excision. Another case, germinoma, central neurocytoma, pineal region tumor, and finally GBM involving the thalamus and the caudate. Headache was the most common presenting symptoms in about 70% of the cases. Second is nausea and vomiting in about 40%. Visual disturbance about 25%. Seizure about 17%. And then comes after that mental changes, disturbance in consciousness, gait disturbance, motor disturbance, dizziness, and urine incontinence. Astrocytoma was the most common type of tumor. Second is pineal region tumor. Third is colloid cyst and central neurocytoma, and different other histopathology. The transcortical approach was used in about 45% of the cases, endoscopic approach in about 25%. Third is the transcallosal and different other approaches. Seizure was the most common post-operative complication in about 12% of our cases, intraventricular hemorrhage and wound site infection in about 6%, hydrocephalus in about 4%, diabetes insipidus, visual disturbance, weakness, and ventriculitis in about 2%. We had 2 mortality. One died from hypothalamic syndrome and the other patient from brain abscess and ventriculitis. In our series, the risk of post-operative seizure was 12%. However, selectively after transcortical approach, the risk was 20%. In the literature, the reported risk of post-operative seizures after transcortical approaches ranged from 19 to 75%. The reason for this wide range is that it's hard to determine the true incidence of post-operative seizure since there are many factors that contribute to seizure, and they include the tumor type, presence of residual tumors, subdural effusion, and electrolyte imbalance. This is one recent study that evaluated 40 cases of tumors involving the lateral, third, and fourth ventricle, and in their study, the post-operative complications were hydrocephalus in 15% of the cases, meningitis 12%, ventricular hemorrhage 10%, motor deficit 5%, subdural collection in 2%, and there was no report of post-operative seizure. They had 1 mortality in 1 patient from ventricular hemorrhage. Another study evaluated 46 patients with tumors of the lateral and third ventricle. The post-operative complication were neurological deficit, 8%, epidural, subdural hematoma, or both in 8%, severe brain edema in 4%, post-operative seizure in 2%. They reported 1 mortality from ventricular hemorrhage. In conclusion, the primary treatment method for ventricular tumors is surgical resection, and considering the advantages and disadvantages of each approach, the transcortical approach is associated with increase in risk of post-operative seizures. I would like to thank Professor Sherif El-Otidi for being a great supervisor and mentor. Thank you very much.